Before Hastings.
Thank you, Acting Speaker, and I am very happy to rise and speak to the Mental Health and Wellbeing Amendment Bill of 2023. My head is spinning from listening to all of the wonderful debates and contributions that people have made today. This bill makes minor amendments to the Mental Health and Wellbeing Act of 2022 and makes consequential amendments to the Judicial Proceedings Reports Act 1958. This amendment bill has a total of 53 clauses. Many of these amendments are minor or technical in nature, correcting errors, spelling mistakes, and other things. It is nonetheless important that these changes are made before the commencement of the Act in September 23. Now, I wasn't going to talk about Recommendation 10, and like the member for South Barwon, I think I certainly would prefer to be working from a health-led perspective. But I do note that the member for Nepean spoke about in his electorate that the charity couldn't serve meals at night because of violence being committed upon them. And so in that instance, it sounds like we need a police-led response, and it's a very complex dichotomy. I do support the member for Yan Yin's affirmation that we need to get things right. And sometimes that takes longer than we want. And sometimes we have to continue working on things, and I know this government will continue to work on things. I also note that the Royal Commission into Victoria's mental health system set out a 10-year vision to reform Victoria's mental health and wellbeing system, underpinned by a new Mental Health and Wellbeing Act which passed last year. This 10-year vision importantly needed to be brought into action as soon as possible, and so the Mental Health and Wellbeing Act of 2022 was put together with some urgency. I recognise the dedication, perseverance and important work of the mental health and wellbeing workforce as the mental health and wellbeing system develops. I also recognise and thank those people with lived and living experiences of mental illness and psychological distress and their commitment to working in partnership to achieve the vision of the Royal Commission. But due to the urgency of bringing this bill about, there were some issues, as mentioned previously, around clarity and technical references and some bigger issues. And they need to be addressed, well, they're part of the Mental Health Wellbeing Act of 22, and they need to be addressed, and they will be addressed with this amendment bill of 2023. The Royal Commission into Victoria's Mental Health and Wellbeing system recommended the Labor government replace the Mental Health Act of 2014 with a new Mental Health and Wellbeing Act. The Andrews Labor government delivered on that recommendation last year. The 22 Act sets out rights-based objectives and principles for responsive services to make sure people seeking care are involved in decisions about their treatment and support, as well as incorporating a statement of recognition and acknowledgement of treaty process. It also supports a transformed mental health system that is integrated, contemporary, adaptable, and places lived experience at its heart. And I've heard many people in this chamber talk about lived experience and living experience, and I never get sick of hearing that. And I can't hear it enough. Placing people with lived experience at the heart of not only the Health and Wellbeing Act, but at the very heart of the mental health system, it is a key theme of the Royal Commission that this system will be guided by people with lived experience of mental illness and lived experience at the centre of the new Regional Mental Health and Wellbeing Boards, Youth Mental Health and Wellbeing Victoria, and the Mental Health and Wellbeing Commission. It sounds health-led to me. It means that people with lived and living experience will be on the ground floor, being involved in writing policy, developing programs, delivering outcomes, and importantly, dealing with those that walk through the door needing help. This is fantastic, it's timely, it's much needed, and guess what? It's now being delivered. Over the last couple of years, the Andrews Labor government has invested $5.7 billion into mental health and delivering on the recommendations of the Royal Commission. I had the opportunity to read through some of the 2022 Mental Health and Wellbeing Act just to familiarise myself, as I wasn't here last year when it was debated. It was 688 pages long, 885 separate line items. It's very complex, complicated, very in-depth, and I'm not going to claim I understood every bit of it. But one of the things that I came across, which impressed me a lot and made me feel very happy about the direction that the bill was taking, was section 1.5, in the mental health 1.5, which is the mental health and wellbeing principles. There were 14 principles outlined, and it seemed to me from these principles the rest of the Act was determined by them or being shaped by them. And I felt that in reading about these principles that the community was being looked after. The community was at the heart of the Mental Health Act 2022. And with this amendment bill of 2023, it will continue to place the community at the heart of the Act. I thank the many, many people that worked on the Royal Commission into Mental Health and to all those that actioned the recommendations and wrote the 2022 Act. An amazing piece of work, an important piece of work, and now being implemented. I just want to talk a little bit about some of the principles because when I read them, it was a pretty dry read in a way, but somehow they warmed my heart. And as I've spoken to, in this chamber before, hope lives rent-free in my heart. And when I read the principles, that gave me greater hope with the way we are working. So just a couple of the principles. The diversity of care principle. A person living with mental illness or psychological distress is to be provided with access to a diverse mix of care and support services. This is to be determined as much as possible by the needs and preferences of the person living with mental illness or psychological distress. Lived experience principle. The lived experience of a person with mental illness or psychological distress and their carers, families and supporters are to be recognised and valued as experience that makes them valuable leaders and active partners in the mental health and wellbeing services system. Health-led. Wellbeing of young people principle. The health, wellbeing and autonomy of children and young people receiving mental health and wellbeing services are to be promoted and supported, including by providing treatment and support in age and developmentally appropriate settings and ways. It is recognised that their lived experience makes them valuable leaders and active partners in the mental health and wellbeing services. I think all these points are health-led. I found something very comforting in all of those words, and I think the community would too. I'd also like to mention recommendation 3 in the Royal Commission, which is to establish a responsive and integrated mental health and wellbeing system in which people received most services locally and in the community throughout Victoria, close to their families, carers, supporters and networks. The Commission also recommended the establishment of up to 60 local adult and older adult mental health and wellbeing services across Victoria. These have become known as locales, as the member for Frankston called them recently. Presently 6 have been opened, a further 9 will be opened by the end of 23, and there are another 12 hoping to be started on next year. I recently visited the Frankston Mental Health and Wellbeing locale with the member for Frankston and also the Minister for Mental Health, who announced the beginning of walk-in services in the coming weeks and a weekend service to kick off in the coming months. Locales or locals are designed to deliver integrated mental health and wellbeing treatment, care and support for people aged 26 years and over. They will also provide integrated treatment, care and support for people with a mental illness and co-occurring substance abuse or addiction, coexisting disability and trauma. Local services are free, voluntary, easy to access, no referral is required, and delivered with a philosophy of how can we help and no wrong door approach. I only wish 23 years ago this service was available to my brother. If it was, he still might be with us today. Lived experience will also be a central pillar and be embedded in new entities, including regional mental health and wellbeing boards, through a new Mental Health and Wellbeing Commission, and the member of Mordialloc talked about this. The Commission will provide statewide oversight of the mental health and wellbeing system, including through a new complaints resolution investigation process, and will hold government to account for the performance of the system and the implementation of the Royal Commission recommendations. Health-led. The Mental Health and Wellbeing Act 2022 has been passed, and now we need to pass this amendment bill of 2023 so we can continue to do the work that this government has been doing, will be doing and continue to and is committed to doing. I commend this bill to the House.